Hey, Dr. Dale here. I had a conversation over the weekend with somebody who found out I was a chiropractor. And of course, oftentimes is the case when they'll say, hey, once you start going to the chiropractor, don't you have to go forever? And this is the first time I ever kind of played it with this sort of response. But my question to them was, when you go on blood pressure drugs, when do you get off of those? When you take statin, take cholesterol lowering drugs, when can you go off of those? And of course, the answer is never. They're always wanting to manage you with those kind of medications because they don't work. They don't do what they tell you that they say that they'll do. I mean, statins, if you take them before you've had a heart attack, they add 3.2 days to your life. If you've had a heart attack and you take statins, now you've got 4.2 days added to your life, which, you have those years of, declining health because statin drugs are removing cholesterol from your body. 50% of your brain weight is cholesterol. Every cell makes cholesterol. Like, it's totally necessary. And it doesn't prevent you from having, lower numbers of cholesterol count, doesn't make you have less death, And if you look at all-cause mortality with these cholesterol lowering drugs, it goes up. So they don't help you. It's the world's most, utilized and sold drug for now until GLP-1s take it over. But, medication is pushed because it makes lots of money. And we're sicker now than we've ever been. We have more doctors than we've ever had, and yet we're still sicker. So the question is how often do you have to go to the chiropractor? Is it forever? And the answer is no. Chiropractic fixes people. Chiropractic restores, motion and neurology and gets at the root of the problem. It doesn't mask the symptom. I mean, if you use it correctly, you hurt your back and you get adjusted a couple times, you feel a bit better. That's one thing, but going in there and correcting the problem and working on the motion segments and counseling people on lifestyle choices, that is going to help people get better and not need services for the rest of their life. Now, I hope that everybody chooses to maintain their body and get adjusted a little bit over time, just like you maintain your teeth. But, brushing and flossing only go so far. Once you've got that cavity, you need a little extra help. And so that's the same thing with chiropractic. The intervention of getting adjusted is, the same thing that we would do when you have back pain is the same thing that we would do when you don't have back pain. In other words, the prevention is, quote unquote, the treatment. It's the same thing. Get your body working better and it will heal itself. So you don't have to go to the chiropractor forever if you don't want to. But a lot of times people choose to. Once they get their initial encounter, they feel a whole lot better and they want to maintain that. So, and there's no side effects. You're not going to die of liver damage from getting adjustments. You're not going to be polluted with mercury from getting a flu shot. So if you want to get healthier, you got to make that choice. And chiropractic is at the center of that, whether you know that or not. But I'd love for you to come in and ask me some more questions, and I'd be happy to explain it to you. My website is drdaledc.com, and we're located in Uptown Ankeny on 3rd Street. Love to meet you.